Right. So, good evening, all. Thank you again and for joining us. And we are yet uh, again to start a very another informative session. And thanks, special thanks to Bombay Ham Company Boeco for ensuring these kind of sessions are there as far as medical cannabis is concerned, and they will be discussing certain aspects. Today we have Jahan Pestanjama as the founder of Bombay Ham Company, and we have Dr. Swapnil Bachao, one of the leading medical cannabis practitioner in our country. So, excuse me. Yeah, sorry. So, just prior to start the discussion today, we thought and we got this feedback as far as our medical fraternity is concerned, that yet have let's have some kind of an interaction, some kind of a discussion, that what kind of various FAQs, what kind of various queries or maybe aspects are there which we need to discuss, and then accordingly we can take it forward. So on that note, the model of this session today will be, there will be certain questions which are already our team has received, and like the Jahan founder, Bombay Ham Company will be taking that up. And I also request all of you who are watching this live right now, feel free to post your queries and questions also. And once we will discuss some questions which we have already received, we will also taking up your questions and queries as well accordingly, and we will try to answer as the best possible from my end, as well as Dr. Swapnil and Jahan also can share his inputs on that. So, not wasting much time, I will hand over the session to Jahan for further proceedings of the session. And again, I thanks all of you for joining us. Keep supporting, and let's grow together in the medical cannabis domain. Jahan, over to you.
Thank you so much, Dr. Piyush. And it's a pleasure to be together on such platforms. In this case, with yourself, and in a very happy scenario to have Dr. Swapnil join us, who's between both yourselves are sort of twin towers of experience of medical cannabis-based practitioner experience and understanding. And as you mentioned, Dr. Piyush, correctly, that over time we've gotten a lot of feedback and advice from doctors and practitioners that they would like an interactive session to learn from the most experienced medical practitioners who have actually been working with Ayurvedic medical cannabis and medical cannabis different products and formulations. In terms of how it's best used, what effects they've seen, and what are the key things to keep in mind as well. And especially from the perspective of chronic pain, whether cancer or non-cancer based pain, even from a Bohico perspective, one of our products that is Cancer Relief Pain Management, and we have a pain management strong that we've worked with many different doctors and patients to across indication areas to actually assist them with symptomatic relief and the analgesic effect of cannabis with great effect also. And that's where in keeping that mind and that setting in mind as well, I think what we'll do is, as Dr. Piyush mentioned, we'll go ahead and jump straight into proceedings. We have a couple of questions lined up. I think the order we'll stick to is I'll begin with Dr. Swapnil, asking with Dr. Swapnil, and hand over to you, Dr. Piyush, for your perspective after that as well. So, without wasting any further time, to get into the first question for you, Dr. Swapnil, now that over the course of your career, you've built tremendous experience, having worked with a range of different patients suffering from chronic pain, whether cancer or non-cancer based patients. What benefits have you, as a practitioner, seen that medical cannabis-based medicines have actually provided to such patients? And if you could share some case experience and understandings about that, that will be great for the audience.
Okay, sure. Thanks for having me on board today. And to start with, medical cannabis as a drug, I would say this is a boon that our country has. Since our country, since ancient times, we are using cannabis in medical use. But in certain period of time, if as we have seen in the past couple of years, it's booming up. The medical cannabis industry is booming up for certain reasons, obviously because it is very beneficial and it has shown its potency in treating various chronic as well as acute ailments. Most of the patients that I receive are either chronic pain patients, patients suffering from psychiatric disorders like depression, anxiety, even schizophrenia, bipolar disorders. And then there are many cancer patients who are, in various stages of cancer, in the last stage, in the first stage, who are undergoing chemotherapy or radiation, and they have various side effects. especially vomiting, nausea, post chemotherapeutic pain or post surgical pain. These are most of the patients that I receive. And usually these patients have tried various treatment options before, before coming to me. So they are taking the conventional medicines quite for some patients they are taking it for like couple of years, but they have never experienced complete pain relief or complete relief from nausea, vomiting, or loss of appetite that they have been experiencing. And when I have started these patients of medical cannabis, uh, within few weeks or some patients even within few days, they experience very good results, especially with pain, appetite stimulation, sleep, anxiety and depression. And there are few patients who are going through chemotherapy that start responding very well to chemotherapy, whereas they were a bit resistant to chemotherapy before. But after starting medical cannabis, they are being more responding to whatever the treatment, conventional treatment they are receiving. And there are a lot of patients, cancer patients, where I have seen the reports after using cannabis for 1 year, where either the tumor has been, I wouldn't say it is completely cured. We are, but we can definitely see a difference. That in the tumor size, also the metastasis rate has decreased. In few patients, it's stabilized. The tumor has not metastasized like it was doing before starting medical cannabis. So there are many anecdotal cases and evidences which I have seen in my own practice where patients have benefited using cannabis in pain and in cancer. And certain patients who are on psychiatric drugs, I don't say that they should stop the conventional therapy, but when they use it with medical cannabis, they find much more relief from the symptoms. Their sleep is better, their thinking pattern is much more better, they find themselves more relaxed, and hence, and continuing medical cannabis, there are no much side effects, because we are dosing them in a proper ratio, in a proper dosage. So doing that under medical guidance, under a practitioner, will definitely prove beneficial for the patient.
Thank you for that, Dr. Swapnil. I think that's really helped build a initial very strong understanding and perspective of your experience, having dealt with a wide variety of cases. I'd like to turn to Dr. Piyush to get his perspective and, of course, his experiences as well, of course, from a similar setting and point of view. So, Dr. Piyush, I'll hand over to you for your insights as well.
Right. So, correctly mentioned by Dr. Sapnil as far as pain management is concerned. However, we need to understand one aspect here in India. See, what happening is now, as medical cannabis is getting propagated and like people are becoming more and more aware. As far as if we are talking about cancer, in fact, to my all fellow practitioners, I can see right now more than 300 people are watching us live on various platforms. And this video will also be posted on all our platforms, and later on, many people will watch. So, I want to clarify one thing here is see, we need to understand as far as cannabis plant is concerned. Right now in India, predominantly we have medicines manufacturing from the leaf extract. Now with the leaf extract, the THC is at a very minimum level as compared to the flower and bud medicines. And cancer management or cancer kind of cure, I don't want to use the word cure, but reduction is there. And in many cases in US, Canada, and other part of the world, where they are using the medicines which are being manufactured from the flower and bud, are showing better efficacy as far as the cancer tumors and reduction. And along with chemo and radio, many patients are being healed. 50% lesser cycles are being like implemented, or recurrence rates has been reduced 50%. These research studies are available now. In India, the problem is till now we have not got the approval to manufacture medicines from the flower and bud, which will be maybe in some years. We are all are fighting for that only. So we need to understand. So the medicines which are available are not that much effective in terms of reducing the cancer tumor or reducing any kind of like cancer aspects in the body. But yes, if we talk about the quality of life, if we talk about managing pain, reducing nausea, those kind of effects. And the best part is, which I really liked about cannabis, it makes people happy. the endorphins, the other mechanisms are there, the endocannabinoid system is there. So already the patient is so much depressed, so much psychologically challenged when he or she is having cancer means to them is like end of their life and all sometimes. So that also helps, the cannabis also helps in elevating their psychological health, and they are able to sleep well. So that kind of feedback also we are getting. Definitely pain is one of the primary reason. I remember one case, the son of a lady, he was literally crying that my mother is not able to get relief from the pain. And he was he they have tried all the highest level of opioid analgesics and all, but when they started medical cannabis from the day one, as correctly mentioned by Dr. Swapnil, within few days, in fact sometimes within 1 or 2 days, we can get the feedback that yes, pain is better now, and pain is a kind of relieved now. So within a day or two, she was relieved and the pain was significantly reduced, and her son was also very happy. So so many cases are like this, and pain management, quality of life definitely is there. And by the way, already the chemotherapy, the radiation and everything will have huge impact and side effects on a patient's body. And along with that, if they are able to and along with that, if they are managing their other issues by other medicines, their side effects also will hamper. And in cannabis, those kinds of side effects are also not there, which are there with some kind of analgesics and some kind of other aspects. So that also we need to understand. So by and large, it will be a win-win situation in many aspects if we are adding. In fact, I request, on that note, I request all the like medical or surgical oncologist or whosoever is practicing cancer care in India, if they are watching this channel, this session right now, or maybe people can propagate later on, that at least they should collaborate now and take it forward. I respect certain oncologists; they are coming forward and connecting to us and many other now doctors who are practicing medical cannabis, but still they are very few. So that we need to, I think, create more and awareness in our country. But yes, absolutely, cannabis medicines are there, will be there, and will be definitely increased. And I request also government authorities that let's have bud and flower medicines approval also as soon as possible, because in India now cancer is spreading a lot and many people are suffering from this. Over to you, Jahan.
Thank you so much for that insight, Dr. Piyush. I think there are a couple of interesting points you bring about is the difference of the leaf extract and its symptomatic relief within a certain range vis-a-vis how the bud and flower works in in other countries in North America and Europe, where the mg is on average 250 mg, 300 mg when they're putting it in a therapeutic cancer-based oncological setting, where you're seeing apoptosis, you're seeing necrosis. There are Spanish studies that show this in animal model, and now as you mentioned, it's about scaling it up to generating human based evidence as well. And even particularly, I think you touched upon a very important point, and I'll just hand over to you, Dr. Swapnil, to really kind of narrow down and really pierce down on this particular perspective around symptomatic relief when it comes to cannabis based medicines within chronic pain, cancer or non cancer based patients, and how it particularly works. As we've seen, one of the side effects of chemotherapy drugs lead to sort of sleeplessness, the sort of the tastelessness of food, being able to generate an appetite, as you mentioned, CINV. In terms of these symptomatic relief areas, what are some of your experiences and your understanding, having worked with a plethora of patients, about how cannabis based medicines are providing that relief along with generating that analgesic potential and sort of capability? So I'll hand over to you, Dr. Swapnil, to get your insights on the same ones.
Yeah, sure. So I have had a couple of cancer patients who were in severe pain. Uh, I mean, the pain, the scale was almost 10 out of 10, you know. And these patients were, they were cachectic sick. They could not eat anything at all. They couldn't sleep. They were sleepless from past few couple of years. And they were on many opioid medications and, for pain, for sleep as well. And these patients, when they were started on cannabis oil, like that we have, specifically, I would mention like something around 1:1 ratio CBD to THC, the whole leaf extract, I would mention. They within 3 to 4 days, they started feeling much better. Within the pain subsided in 2 to 3 days, Within 2 weeks, they would they would mention me that they are able to eat much better now. The appetite increased, and the nausea, vomiting they had, that subsided considerably, and that provided them a good quality of life. And due to this, what happens is once the patient starts eating well, sleeping well, the other symptoms also start disappearing, and the patient lives a much better life, I would say. I won't say the cancer is cured, but definitely the quality of life gets improved in these patients. I would like to mention about a case I had regarding multiple myeloma. Uh, this was a pediatric patient, and the parents, they were on call with me for a couple of times, and they mentioned about the treatment that is taking, and but he still had this immunoglobulin M spike on electrophoresis, which indicates that he has multiple myeloma. But after starting cannabis oil for a couple of weeks, when after a month, when he just after a month, when he did his immunoglobulin spike, it was absent and on electrophoresis. And so even though his oncologist told him that you know there is no multiple myeloma as for now, so he's completely free of multiple myeloma, and he's continuing the medical cannabis treatment. I've told him to continue, and there are really, so this is one case that I myself have evidence of where I have seen that the patient is cancer free. And
That's
this,
yeah, please go on, please go on.
yeah, so there are several patients as well. I won't say that they are cured of cancer, but again, there are two cases from North India where the patient had a glioblastoma multiforme, which is a very aggressive tumor, of the frontal lobe. And that patient, the tumor has shrinked a bit, in a year span of a year. So there are these two cases where I would say, we have some evidences, even using the Indian whole leaf extract. Yes, definitely, as Dr. Piyush rightly mentioned, in Canada, in US, in the West, they use buds. So they have this higher amount of THC, plus they have different strains, and they do also have they don't lose upon the terpene profile, like certain terpenes like limonene or mycene. There are various other terpenes as well, so they have their functionality as well. When used in conjunction with CBD and THC, definitely it provides a synergistic effect. So that is something we still lack in Indian medical cannabis industry. But I would still say the landrace strain that India has is pretty good, and the results that I have had using the Indian medical cannabis is pretty well. I mean, the results are very good, especially for pain and sleep, and even for cancer patients. So there is definitely there's a lot of room for improvement. Since once we start using the buds, we can have different varieties of tinctures with different terpene profiles. So that is something I'm looking forward for, that we can start doing once it's allowed, it's legal. And yeah, so that's about it.
Definitely. No, thank you for that, Dr. Sumner. I think those two particular cases you highlighted would, provide a lot of food for thought for a lot of doctors
Yeah.
and practitioners actually watching who are dealing with such cases in real time as well. I remember even separately, just quickly on our front, we've also had similar patients, of course, with the glioblastomas and testicular cancers. As you mentioned, it's because of its aggressive growth, it becomes very difficult to live with that quality of life you want. And what we've seen is, fortunately, our cannabis-based medicines, the 1:1 full spectrum pain management formulations have helped them live their life to a point where they're able to drive their car from state to state, be with family, really give them those intangible moments, with their loved ones, which is very important for their health as well as the improvement of their health as well. And I remember there's a case of a friend of mine. I remember he was working in Africa. He had fallen into a ditch and he had gotten a very bad swelling, extremely bad swelling, and he come back to India, and nothing had worked. No painkillers, no NSAIDs, nothing had worked. And he himself is a doctor. So he was like, nothing has worked. And I linked him up with a couple of our practitioners who issued him a prescription, provided him the pain management formulation, and in 3 days the inflammation had itself come down. The pain, of course, had come down. The score had come down. The analgesic effect was there, but the inflammation itself in 48 hours was sort of visibly decreased, which was mind blowing to
Right.
see in real time. And it's that type of evidence about the symptomatic relief that we're really grateful for you sharing with us as well. And I'd love to turn to Dr. Piyush to get your perspective, Dr. Piyush. Having worked with so many cases and us having discussed several cases where there has been relief multifold, whether it's appetite, whether it's sleep, whether it's mood, whether it's whether with respect to nausea or different other factors of life. Would love to learn more from you and some of your case experiences and understand more about that also.
Right. See, we need to understand as far as non-cancerous indications, or maybe if we talk about, like as you mentioned about one pain, which and inflammation which was there due to injury. So if we talk about pain, predominantly there are three, four categories. There are joint disorders, there are musculoskeletal issues, there are neuropathic pains, and one specific kind of pain which I really like getting so many patients is fibromyalgia. And fibromyalgia, we are seeing cannabis is working very well, and because that is the most I will say complicated kind of pain to be handled in any pathy. In fact, in Ayurveda also, with due respect to our medicines and with due respect to other pathies, we all know. Dr. Sapnil is from allopathy. I am from Ayurveda. The fibromyalgia cases are very challenging, and with cannabis, it's very easy and kind of a cakewalk when they are just starting from the day one to they are reporting. In fact, we have some testimonials. I remember one of my teacher, his wife was suffering, and I think I presented that as well in last I think some webinar also. So that kind of confidence, that these kind of cases are giving us that kind of confidence that yes. And in fact, she was taking so many initially painkillers. To do that, she was having some side effects, gastric discomfort and all. Then some neuropathic pain medicines like gabapentines of the world, and also, but still she was not able to heal that. So in fact, neuropathic, on that note, neuropathic pains are also very challenging pain to be handled in a clinical practice. And cannabis is working so well. In fact, I was just reading that neuropathic pain, there are so many issues, but the main aspect is either some kind of an injury to neuron, or the stimuli, the sensation to the stimuli, or the analgesic issues which are so the pain issues which are there. And cannabis is cannabis is, in fact, in pain management, the cannabis role is two dimensional. One is for example, in any organ we are having pain, so the suppression or the signal to the brain that we are having pain, that is one thing which we are using medicines which we are calling as a painkillers or pain suppressants, or whatever like you want to use the terms. And but on the other side, the healing also is there. As you mentioned about the inflammation is been reduced, that proves that the medicine on one side is sometimes reducing, cutting down, suppressing, whatever you want to quote, as far as the pain sensation is concerned. And the second aspect is the healing, the root cause, the reason due to which the pain is there. So it is a two dimensional effect which we are seeing as far as cannabis medicines are concerned. And second, in fact, I don't want to rank anything, but yes, we have seen very good results specifically in the insomnia cases. However, just we need to understand that it's not a bedtime medicine. It's like it has to taken at least 1.5 hour prior to the bedtime. Bedtime means whenever just you're just lying on your bed to get a sleep. So initially, that was a learning for us as well few years back when we started medical cannabis practice. And now to the patients also we communicate that take at least 1.5 hour prior to your bedtime, and then just relax and go to bed at your time, and they are able to sleep well. In fact, one of my case I remember, he was taking three medicines in parallel, high level oxidatives and all, with the highest dose he can take as per his age and body weight. Still he was not able to sleep. And from the day one when we started cannabis, and he was able to sleep without any other allopathic medicine. And in fact, in Ayurveda also sometimes we have challenge to induce sleep as far as sleep in medicines are concerned in Ayurveda. But cannabis is working very well in those aspects as well. And again, in this scenario also we need to understand. So one is to induce the sleep or to make people sleep. Second is to improve the quality of sleep. The REM is there, and if the more REM, the disturbed the sleep will be, and the quality of sleep will not be good. So it has to be in a controlled manner. And third very important aspect is the cannabis is uh, converting in fact it's a very interesting research study I was referring. So sometimes many of us have negative thoughts and negative dreams or that kind of aspects in our sleep, and that disturb us, and we are not feeling fresh when we are awake in the morning. And cannabis has been proven in research studies that that negativity will be gradually converted into positivity. Very like interesting study I read somewhere. And so the negative dreams and the negative thoughts will be converted into positive thoughts gradually due to the endocannabinoid system involved in that. So these kind of cases now we are getting in clinic. One lady I remember, she was having some personal issues with marriage and all, relatives and all. And she was having very bad and negative impact, and then recently she lost her father in the second wave of covid. And she was not able to sleep, and some negativity and negative thoughts and everything was there. And when we started cannabis, so after a few weeks, she along with her husband shared this feedback that now gradually, in fact, she is more happy, and that negativity, and in fact her husband shared that with me separately, that negativity gradually I'm seeing is gone. And she is not in fact sometimes talking also about that negative aspects which happened in the past years. So I think that kind of healing and that kind of effects we are seeing from cannabis. And yes, absolutely correctly mentioned by Dr. Swapnil, all the other aspects I don't want to repeat those aspects, but these are some of my findings and some of my cases which I have seen in our clinical practice. And one more very important aspect is the ulcerative colitis. We are seeing very good results in the ulcerative colitis patients, and this can be one of the drug of choice I should recommend for ulcerative colitis. We are seeing, in fact, especially those cases where we have exhaustive all other options and still they are not able to get relief. And with the medical cannabis, it will take some time. It will take, it's not in the, as in the case of pain management insomnia, it will not start from the day one the effect, but it will take some time, at least 2 to 3 weeks. But yes, absolutely, after that you will see a very significant improvement in the cases which we are seeing in our clinic. So I think, and otherwise the disease list is so long because the endocannabinoid system is responsible at every organ and at every disease. Sometimes doctor asks that, okay, how you can say the same medicine is working for pain and the same medicine is working for sleep? We are not able to understand that. It's not like some kind of magic you are talking about, or some hypothetical aspects you are talking about. This is just pure science, and we have to just correlate everything to ECS and other mechanisms which are available. And correctly mentioned by Dr. Swapnil, terpenes play a very important role. Flavonoids are also significant in some aspects. And then cannabinoids are so much vast and huge. I don't think so. A single life is possible to read and understand about all the cannabinoids present in cannabis plant. But still, as per our limited exposure and knowledge, we are trying to explore as much as we can. Right, John, over to you.
Thank you so much for that, Dr. Pierce. That's extremely insightful. And I think, particularly from a QOL or quality of life point of view, how multifold it is working with the CB1 and CB2 receptors across the body, it really speaks in its results. Is in fact, when I was having a brief conversation with Professor Rafael McCullum from Israel, the legendary scientist who played a role in Anandamai's discovery, etc., he was very excited to know how practitioners like yourself and Dr. Swapnil actually generating physical or case evidence. So it's a very it's the exact approach scientists and practitioners across the world have been hoping that India has should take up. And how this actually works on, say, for example, 2AD or anandamide, or I think Dr. Swapnil touched upon something interesting, was how it is not inhibiting the effects of chemotherapy based drugs, but is expanding or expounding on their effect and enhancing their effect, which is such a these interesting observations make for the larger case of it. And I think, Dr. Piyush, you touched upon something interesting, whether it's fibromyalgia, ulcerative colitis. The versatility of efficacy is very interesting with cannabis-based medicines. And I'd love to hand over to Dr. Swapnil, particularly, Dr. Swapnil, I remember at the start you mentioned, a range of patients dealing with, neurological disorders, mood and anxiety and stress, and, neurosis-based disorders, and how you've seen use case cannabis-based medicines efficacy in that. And of course, post this CME, we'll definitely schedule a follow-up one where we'll jump much more deeper into detail on that. But sort of as us a brief insight into some of your cases and experiences. What type of therapeutic benefit have you seen in patients of these categories and natures as well?
So, most of the neurological patients, I would mention about Alzheimer's disease, Parkinsonism, essential tremors. These three diseases I have seen a good change in the patient's symptoms. For example, essential tremors. These patients, when they take medical cannabis, within 2 hours or 3 hours, depends upon the threshold of the patient, the tremors disappear. You know, and when used, regularly, these tremors they like decrease by more than 50%. I've seen patients where the tremors have disappeared almost 80%. There are cases where the patient is like almost disease free, but definitely they need to continue taking medical cannabis as per the prescription and as per the dosage. And there are a few patients with Parkinsonisms where I have seen 60% improvement of symptoms. Around, I would say the average improvement is anywhere between 46% to 60%. So there are certain patients who respond much better. There are certain patients who take more time or a higher dosage to respond. But definitely there is improvement in Parkinsonism as well, especially the fascinating gait that they have, the stiffness that the patients have. The stiffness does, it works wonderfully, the stiffness. The patients, they become more mobile. They can do their daily chores, they can go for a walk. And the falls that patient experience, those are also reduced. So usually in these patients, it's just vital to check if the patient isn't hypotensive. In certain patients, they are hypotensive, and then sometimes in these patients, we need to keep more check on the doses they have been taking. So that is the only thing that you need to monitor. While especially in Parkinson patients, I observed sometimes they might observe a bit of dip in the blood pressure, but not all of them. Patients who are suffering from hypertension, only those. And whereas I remember a patient of neuralgia who had a very very bad suffered a very bad accident a couple of years before, and post that he was into he developed PTSD, chronic neuralgia. He even tried ketamine therapy, which is one of like the last options, and even that could not relieve his pain. He could not sleep, he could not feel half side of his body. And he's a young guy, like 34 years, 35 years, and he started on medical cannabis. I gave him a higher dosage of THC though, because he had this severe pain and he already had so many opioids and he had a high threshold for pain. Within 2 to 3 weeks, he was much better. And then we started increasing the dosage further. And now he is like almost, he says like he's 80%, almost his pain is gone. And he has started feeling his right side of the body again. And it's all new for him. He's relearning now because, for many years, he was not feeling anything on his right side of his body. And now he could not talk to people. He lost his confidence. Now he's gaining back. He's back to work. Uh, he's pain free. He's working out. He's exercising. So, that's a very big difference. And he keeps calling me and keeps thanking. And, he's a strong supporter of medical cannabis because it changed his life. And there are many of his friends and relatives who also suffer from certain ailments, and they have resorted to using medical cannabis, and they are doing really good now. So there are a lot of neurological patients who are, and I've seen one. I mean, it's a problem in India is that a lot of patients, they have heard about medical cannabis, but they yet do not know from where to source it, whom to reach out. So that is one issue I have seen in patients, because certain patients, they call me and they tell me that they have been trying to find someone who can provide them medical cannabis for like past couple of months or a year. So this is one issue. I feel that the we should be people should be more reached out. Something that will help them to find medical cannabis more easily online or whichever way is possible.
Absolutely, absolutely. I think you raised some very important points there also, Dr. Swapnil, and particularly from a case point of view, I think highlighting how important it is, even from a neurological standpoint, is very critical, because cannabis's function on the brain standpoint, unfortunately, globally has been limited to the recreational, illicit, combustible based use, and how it has sort of it impairs neurocognitive function. But the counter thesis is, if it is dosed and administered properly by experienced practitioners in the right therapeutic settings, it interestingly enough has certain therapeutic benefits. And even in our case, we've seen patients with Parkinson's with mild dyskinesia not able to walk straight for 10 years after going on a cannabis based medicine dosing regime. After a week, they're able to walk to the market, buy their vegetables, keep that sort of function and memory going, which is very strong as well. And I remember we had done an activity where we mapped out, of the thousands of patients, how many, what are the indication areas, and we were stunned that there were patients of almost 55 different indication areas that were using the same formulation and product and seeing benefit. Now, when you go about building a thesis for even from a doctor perspective, and I'd love to hand over to you, Dr. Piyush, is the sheer width of how cannabis based medicines can be used, actually utilized, has expanded even multifold, particularly in the modern day times where we live in, where topics like immunity, your inflammation, immediate gratification of having an analgesic effect, or giving you anxiolytic effect or a sedative effect, exactly what you're looking for in that situation. I'd love to get your perspective on, I know you briefly touched upon fibromyalgia and ulcerative colitis, and would love to hear some more of your understanding of case experiences, in perhaps non exactly chronic pain based settings for cancer based pains, etc., but in other indication areas where you've really seen cannabis based medicines have good effects.
Right. See, as I discussed the certain indications, now we need to understand, as more and more practitioners and doctors are also getting involved, and we are also seeing the bouquet of diseases being increased as far as Indian clinical practice is concerned. And right now, apart from, in fact, if we just go back to our ancient textbook in Ayurveda, there are around 200 190 more than 190 formulations are there as far as cannabis is concerned, and they have touched upon on various diseases, on various indications and various systems. And this is very amazing, by the way, because ECS has been discovered recently, and 5,000 years ago ECS was not there. Still our acharyas and our rishis were able to correlate the cannabis plant with all these systems, and it is clearly mentioned about the pain management, about insomnia, about ulcerative colitis, and many other indications. And specifically in our clinical setting, if I say, apart from these some indications, gynecological disorders, I personally feel, and we are seeing so many good results as far as yes, we all know the pain in menstrual cycles is again related to the pain mechanism healing of cannabis, but other disorders as well, like for example we are dealing with several PCOD cases and some kind of other gynecological issues, and we are seeing sometimes also I would like to share this like experience that it is acting as a catalyst as well. Like we are giving a standard of care or treatment, and when we are fortifying that with medical cannabis medicines, the healing is pretty fast. And earlier we used to heal cases, say for example in 6 to 8 months, and we are seeing the healing is in 50% of the duration. In 4 to 5 months people are getting healed. So the catalyst effect, or in Ayurveda it is known as Yogvahi, means somehow it is either increasing the absorption of the medicines also along with other medicines which we are giving. Second is also doing some kind of a cell repair, tissue repair level working is also there. And third, very important, many diseases we are seeing that if people are able to sleep well, they are happy, they are relieved in acute issues. The pain is a symptom, but there are disorders which are related to that. So if you are able to give them relief from these issues, the healing will be better, quicker, and faster as compared to the other conventional treatment modalities. So that one aspect is there. So on that note, I think we should infuse and we should fortify the medical cannabis treatment wherever it is possible, because uh, it is one of the safest medicine, to be very frank. And till now, with all the issues and with all the problems we have with other options, in fact in Ayurveda also there are so many medicines having side effects and having issues. So, but as far as cannabis and a plant-based medicine is concerned, I think this is one of the best medicine and solution. And we are also seeing very good results in the pediatric population as well. In fact, we all know that there are certain medicines which has been approved as far as the pediatric epilepsy or pediatric seizures are concerned in US and Europe. But in our clinic also, we have seen that pediatric population, specifically the cases of seizures and epilepsy, is healing well. However, we need to be very cautious about the dose, because in India there are full spectrum, and sometimes it will increase the frequency of seizure as well. So you have to be very smart, and accordingly you have to modify the dose also. Isolates and only CBD medicines are very less available right now in India. So that we need to understand as far as the pediatric population is concerned, and as far as the seizure management is concerned, that we need to understand. Otherwise, we are seeing very good result. Degenerative disorders already Dr. Swapnil touched upon. We are also seeing very good results in Parkinson. Very excellent aspect he has mentioned about the tremors and the gait, and we are also seeing that impact in our patients. And one more aspect I have seen, the memory gain, the memory regain, I will say. In fact, sometimes that particular feedback some patients have given, for example, in Alzheimer, that their elders, their parents were not able to recall their name, or were not able to identify them. And when they started medical cannabis, within few weeks, their memory is somehow maybe revived or repaired, I will say, some kind of aspect. So it's not completely healing or a completely kind of, we can't revive any disease, but yes, at least their quality of life is improved. They are able to do the day-to-day work which they were not able to do previously, and they are able to recognize and recall. Maybe their speech is still a bit impaired, they are not that much fluent in terms of their speech and in terms of their quality of work, but improvement is there, and at least they are able to recall, at least they are able to identify their near and dear ones. So that kind of feedback we are getting with some patients as well. And I think this is mostly by the way, very important aspect I left is the skin disorders, the chronic infection, the fungal infections, dermatitis, eczema. So many skin issues are there. In fact, Boheco has the skincare range, and I think you people have tied up with some leading skincare brands as well, which you can mention right now. So one side is the therapeutic side as far as the skin diseases are concerned. We have seen very good results. The local application as well as the internal administration in many infections, especially the fungal infections, are most complicated to treat as far as skin disorders are concerned. And we have seen very good results with medical cannabis in those aspects as well. But yes, overall skincare, anti-aging, and pigmentation, wrinkles, or many aspects are there. That also we have seen people are responding and discussing with us that they are seeing that impact. And in that, the nutritional aspect is also very important. So if you are taking hemp seed oil and hemp seeds along with the cannabis medicine, that also will help you. I think that can be the one secret of glowing face of Jahan right now as well. So I will, on that note, I will hand over the session to Jahan.
Thank you so much for that, and of course, thank you for the kind compliment also, Dr. Piyush. But of course, you touched upon some very interesting areas and avenues, even particularly from a skin health point. We have a trial on eczema at the National Institute of Ayurveda in Jaipur, and some of the results we've seen are unbelievable. To be very honest with you, and there's more to come once we publish, and those days are coming in the coming few months. But absolutely right that the use of cannabis and hemp-based medicines and products and formulations is very adaptable according to even modern day as well as old time ailment areas. And you briefly touched upon something very important. I think one key thing for practitioners and public to understand is, as with any medicine, there is no perfect elixir, and same is with cannabis, that there are some important things to keep in mind. There can be potential side effects, whether minor, whether moderate effects, your sleepiness, your drowsiness, somnolence, a little bit of anxiety in case you go above a higher dose titration. And of course, there are certain things where doctors and practitioners themselves मतलब थोड़ा घबराते हैं कि how do I do this? What do I take as the next steps? What do I keep in mind? What are the do's and don'ts so my patient is safe then when things are working? And on that note, I'd like to turn to you, Dr. Swapnil, as sort of the last question for today's session, and then we'll hand over to Dr. Piyush post that. Is according to you and your experience, what are some of the important points to keep in mind for doctors or practitioners who are looking to start getting into prescribing cannabis-based medicines to their patients, and what are some of the practical learnings that you would definitely advise them on?
First is the age of the patient. Definitely, geriatric patients, you should be more careful with the dosing because the frequency for falls, as in old ages, anyways higher. So always start it with a very low dose. You can just start it with 1 or 2 drops. That would be that is what I would recommend. And then, as per the patient is responding, take a follow up every week, and then gradually build up the dosage in the geriatric patients. And another thing is always check for a history for blood pressure if the patient is on any antihypertensives, because sometimes what happens is if you're giving a high dose of THC or CBD, like the 1:1 ratio that we have full spectrum, it does cause a very mild vasodilation. So in certain patients who are already on antihypertensives and on a high dosage, they can experience a bit of palpitation or a very low dip in blood pressure. Not all of them, few patients. So which is reversed within few hours. But to be more cautious, always keep a gap between THC dosing and dosing the blood pressure medications. Keep a gap of 4 to 5 hours or 3 to 4 hours at least. This is another thing, and check for a history of falls. If the patient has a history of falls, then you could just dose the patient at night, before sleep, and not during the daytime. This is something that uh, you know I feel should be taken into consideration. And in pediatric patients, try not to give very high doses for THC. Try to give the minimum amount that you can give. Okay, and in certain patients who are taking like schizophrenia patients who are on antipsychotic medications, in them too you need to dose THC very carefully, because sometimes a high THC can precipitate anxiety, and so the schizophrenic patients, they have a very low threshold for anxiety, and they can experience tremors or anxiety if THC is taken in a high dosage. So these are a few indications where therapeutic indications where you need to be a bit more careful. There is no long-term side effect. All these side effects are reversible within few hours. But the patient, since they have never taken medical cannabis before, they really get afraid or scared sometimes. So these are a few points that I would like to mention here.
I think these are very valuable. Thank you so much for this, Dr. Swapnil. I think, particularly around the age, understanding whether they're actually on any how their blood pressure is working, whether there are any blood thinners or the vasodilatory medicines or material. I think these are very critical points that as a practitioner, both from your setting and Dr. Piyush's setting, this type of information is invaluable to doctors going forward as well. And I'd like to get your perspective also, Dr. Piyush, that, particularly from your understanding, what are some of the key do's and don'ts, and what are the key, go areas and no go areas from, like the practitioner principle of how cannabis-based medicines should be, judiciously used and prescribed and looked at by doctors in both Ayurvedic as well as the allopathic setting.
Right. See, I think Dr. Swapnil has touched upon all the major aspects as far as the cannabis, like medicines, do's and don'ts are concerned. But I would like I don't want to repeat that, but I would like to add some more aspects which are like we have seen. So, for example, we need to understand as far as the pregnant ladies and lactating mothers are concerned. Please do not use cannabis because till now we don't have any data. And in fact, we have the data that endocannabinoid system and the cannabis both are present as far as the placenta is concerned. So cannabis can reach till the placenta. There are some studies in the animal model. That is one thing which we need to understand. Second is for the lactation also it has been seen in the lactating mother, the milk, the highest ratio can be available as far as the cannabis is concerned while we are giving to the mother, lactating mothers also. So in that also, if that is getting passed to the feeding baby, we are not sure right now how it will be helping or maybe having some kind of a damage also. So as far as the pregnancy and the lactating mothers are concerned, please avoid that, and do not prescribe. And if you came to know that some female who was taking medical cannabis got pregnant, please ask them to stop immediately. So that is one aspect which we need to understand till we have more data and more research studies. that it is safe as far as the pregnancy and the lactating mothers are concerned. Second aspect is we need to understand, as far as medical cannabis practice is concerned, the dosage control should be there. So whenever we are giving to a patient, we know that this particular, for example, 30 ml of bottle in with this particular dose which we are recommending. So are they taking that dose or not? Accordingly, both ways. In fact, they have to take the adequate dose, not high, not low, because high will lead and maybe have a risk of getting the recreational mindset also sometimes, and some kind of a dependency as well. And in fact it happens with many other medicines, like we all know about the opioid addictions and other medicines as well. And low also sometimes doctors are very defensive, that they think that it is a very sensitive herb, or maybe let's start with a low dose, let's start with a defensive dose. But that will not work as far as the efficacy is concerned. So that also we need to understand, and accordingly we need to decide the adequate dose. And to the patient, when if they are taking it first time, it's always better we are starting with the evening or night dose with them, that they are predominantly at their home, and do not start with the morning dose upfront from the day one, because it will take some days at least to like body to adopt this particular herb, and then the dizziness, drowsiness, or those aspects will gradually resolve. But now we need to also understand that after maybe few weeks, the same dose will not be able to get the same efficacy which was there initially, because this herb has that capability of getting adopt in the body, and we have to increase a dose bit as well. And then after maybe few weeks or few months, we have to take a pause also, and then restart the medicine. That is also a very important aspect as a practitioner we need to understand, and accordingly we need to take it forward. And we can have meanwhile some other medicines while we are pausing, or maybe reducing the dose, and that kind of permutation and combination we should always have, because the same dose for several months can be less effective, and maybe sometimes patient will give this feedback that now this medicine is not working for me. So that kind of challenges and that kind of understanding we need to have when we are practicing medical cannabis. And also there are several anticonvulsant drugs, there are several other drugs which are somehow contraindicated as well. As far as allopathic is concerned, we can have a separate session to detail discussion, and Dr. Swapnil is having so much of exhaustive knowledge on that aspect as well. So maybe we can discuss that in another session, about the contraindications, about the drug-drug interactions. He correctly mentioned about the antihypertensive, but there are certain other drugs, especially there are several anticonvulsants, and then there are several antiretrovirals also, as far as the research studies are concerned, which we need to be a bit cautious. And rifampicin, for example, is a very common drug being used in the management of tuberculosis, is kind of interacting with cannabis. And there are I think there are two categories: one is the severe drug interaction, and one is the moderate drug interaction, which are there as far as the research studies are concerned. In ayurveda also, when we are using certain other medicines, and in ayurveda it is mentioned as a vish dravya, and ushna virya is there, means the potency is a bit high, and as the schedule even drugs are listed. So if any other like for example we use opium also, we use certain other substances, sensitive substances also. So if we are using multiple in a single patient, or there are some medicines having heavy metals and all, we have to be very cautious while we are practicing, as far as Ayurveda medicines are also concerned, because their potency is also very high. So always design and always have your prescription accordingly, because in Ayurveda we believe in Vata curve, and this particular herb increases the pitta level in a body, in a human. And if somebody is already having a pitta prakriti, that will elevate, and that will increase the issues in a human being. We apply this theory in Ayurveda practice, Vata curve, and we have seen that. So we are giving pit shamak, means to control pit, along with cannabis. And some basic side effects like dry mouth is there. Some people can feel constipation initially. If they are being hydrated well, constipation will not be there. But especially with the classical formulations, I have seen Triloki Vijayavati and some kind of capsules and tablets form, they have gastritis or these kind of, not that much with tinctures, but still dry mouth can be there. Dizziness, drowsiness already mentioned. So these things we need to understand. Otherwise it's pretty safe. Nobody will die if they will drink the entire bottle of cannabis also. But I'm not saying you to drink that, but still it is pretty safe. And I was reading some statement somewhere that till now, not a single death certificate in the world is having the reason of death as cannabis. So, in that note, we need to understand about this herb and this plant, Jahan.
I think you've touched on some very important points, Dr. Piyush, and I think there's an advantage, having the Indian landscape and scenario. What we've seen is there are downsides to what's even happening in the West. For example, the cannabis emesis has become a more increasing topic where, with shatter and dabs and 100% THC and 80% THC at several thousand mg in the US, people actually getting violently sick because of this. This is actually having and potential nephrotoxicity effect or a cardiotoxicity effect or hepatotoxicity effect if people are not careful. And I think what you and Dr. Swapnil have highlighted is extremely critical, so that even if patients are watching or doctors are watching, they understand that it has to be treated as such, that it is a medicine to be used in the right manner and the right
Mm.
means. And I think on that note, it's been a very valuable insight and session. And I think just to check in with you, Dr. Piyush, if we have any questions and if we have like 5 minutes for maybe one or two questions for yourself or Dr. Swapnil, perhaps we can get into that and close the session. Or if in case we're a bit over time, happy to close and have a more elongated session, next time as well.
Yes, we have a few questions. So what I will do is let me just quickly take some question. Actually, in fact, we have several questions. I don't think so. We have that much of time, but still, just to respect all of you and all of you have, I can see the right now also it's a Saturday night, a weekend night, and still 427 is the number right now. People are watching us, so I think it's commendable. And now so many cities don't have any kind of a lockdown, so all you can go and enjoy your weekend. Still, you are watching this session, so it's again very much appreciable. And so the first question, Dr. Sapnil and Jahan, maybe both of you can add your inputs and I can also add as per my knowledge. So do leaf extract work on cancer? If no, any other medications taken or no any other therapeutic treatment taken such as chemo? Means you want to say if somebody is not taking any other medicine or chemo by choice, does the leaf extract only will work as far as cancer management is concerned? Your thoughts, Dr. Sapnil?
So there are researches which show, on animal models though, which show that just taking CBD and THC can, kill the cancer cells by apoptosis or autophagy, the two mechanisms through which they work. But there is no strong evidence in clinical practice which says that only medical cannabis will cure the cancer or the tumor will kill the tumor cells. It definitely does in the research model, but yet we need a study which has a large number of population showing that to emphasize on that only using a full extract would cure the tumors or the cancer cells.
Yeah, I think just to add on to what Dr. Swapnil mentioned, cancer is much more complicated and layered, and as practitioners, you know best as well, that it involves a lot. It involves a nutrition and lifestyle. It involves the right type of targeted drugs at the right time in the environment. Even that has to be microscopically analyzed every single time as well. Even chemo and immunotherapy, where there are extremely good medical drugs that are having a very good effect, and as you've seen Dr. Swapna and Dr. Piyush, even chemotherapy, immunotherapy has changed. It's not what it was जो 20 साल पहले movie में बताते थे. It's not that today. It's even much more modernized. And I think particularly for cannabis, what we've seen is the setting in which, in a cancer-based setting, where cannabis has most value is as an adjuvant, not as the primary therapy, but as the adjuvant therapy, to be able to keep you going, treat your symptoms, be able to treat that QOL, quality of life, because that becomes the defining factor in going into remission and being able to go through chemo and immunotherapy. So I think that's the perspective. It has to be an integrative approach. It's never binary, that is one or the other. And I think that's where cannabis has that adjuvant role. But as you are practitioners and have the experience, would love to hear your thoughts also, Dr. Piyush, as well, adding on to the really great thoughts, insights that Dr. Swapnil brought on as well.
Yeah, see, there is no doubt as far as the anti-cancerous properties of this plant is concerned. But again, our focus area should be on the bud and flower, and government should utilize the at least the medicines out of that, because then we can proceed and have good medicines as far as cancer management is concerned. See, we need to understand already existing medicines, be it chemo, radio, or whatever the options we have, they are very toxic in nature as far as the other organs are concerned, because cancer is like this only. Can the nature of disease is like this, that we have to at least get some kind of heavy potency medicines to destroy that in our body, and that will leave impact on the other organs and the other systems in a longer way, and that we have to just manage somehow during the rest of the years of that patient. Now in that note, if we have flower or bud medicines, at least the toxic effects and at least the damage will not that much as compared to whatever existence options are there. And yes, I'm not saying standalone, but whatever is already going on, and if we can add something, and it has been documented, by the way, the documentary on Netflix which I have seen was Weed the People, right? So it has been documented in the documentary and in many other like research studies also, that 50% reduction is there. And sometimes in those cases where doctors have also exhausted all the options and they were not having any scope or hope or that kind of stuff, and still they are seeing that remarkable recovery. And many allopathic doctors have quoted that in that documentary as well. So and it was about pediatric population, certain kind of cancers in that. So I think if anything which we are able to add on to the existing standard of care, and it is reducing by a significant percentage of 40 to 50 in terms of the cycles and in terms of the recurrence, I don't think so like any government or any country should mind in giving approval to those kind of medicine, because ultimately the patient life is matter, is there. So I think yes, still India needs to like go ahead in many aspects as far as the cancer management is concerned. But at least as we discussed initially, the leaf extract will definitely have at least some impact on all the cancer patients, and we are getting that feedback already from whosoever is using that.
Just to give you a simple analogy, the way we've seen it work out is chemotherapy, immunotherapy, as you said, Dr. Piyush, is important, but then it leaves that effect. It's going bound to leave that biological effect. It's radiation. You're actually using drugs that are going to work at that level. That is carpet bombing of a biological system. But the cannabis-based medicines, your adjuvants, are your surgical strike. And with any army, you require the best of both to complement each other. So I think Dr. Piyush, as you said, that's that complement that really needs to work well. And as you said, there are cases in palliative conditions where leaf extract based use, etc., has shown over the course of time people have become healthy and recovered. They've attributed it to this, but that is something as practitioners, as even as organizations, we know it's important to build clinical evidence towards such effects. That what is the case for one will not always be the case for the other, and that it is a case by case evolving sort of complex matter as well. So over to you, Dr. Piyush, in case there are any other questions from your end.
Yeah, I think let's take one last question for today's session. And again, and this is a very important question, by the way. So, as far as the legalization of cannabis in our country is concerned, I think we need to clarify that again to the people here, that already government has legalized the medicinal use. Already government has legalized the food aspect. FSSAI recently in November issued a circular about hemp seed and hemp seed oil, considering this now as a food in our country. And the rest waste policy, yes, there are some states having some kind of policy, but I can agree that we have to a national level understanding with all the states gradually coming in, that we are just lacking right now, with few states right now are active. But yes, the rest waste policy is still there with some states, and they are doing, like for example Uttarakhand. I remember recently there was one house built from the hemp like material, and Boheco already have a range of hemp fiber, the clothing and all. And so many other aspects are being I think on this question, maybe Jahan, you can give your insights and what exactly apart from medical, because I think this is a very important point raised by Shubham on LinkedIn. I think they are watching live us on there as well. So, as far as uh, medicinal, nutritional, I think we have already talked so much. But apart from that, what else, as far as the hemp usage right now in India, and what kind of level of policy, or maybe what kind of level of business we are, and what scope you see in other industrial usages or maybe other usages of hemp plant as far as Indian context is concerned?
That's a great question. Thank you for that, Dr. Piyush. And I think you've summed it up well. The legality of the cannabis plant for medical and industrial use is under no question. The use of fiber as a natural fiber is legal. The use of seed, as you mentioned, as a food grade product through FSSAI as well as an Ayurvedic based food product is legal. The use of leaf as an ingredient under Schedule E1 under drugs and cosmetics for Ayurvedic medicines is legal. And even the cultivation, where states are working to allow for the flower based cultivation, even that is legal in theoretical settings. Now, as you mentioned, the next step is how does it go into how does because the flower, as we know, is ganja under the NDPS Act, and needs will always be treated as a narcotic manufactured drug, and preparation will go through a pharmaceutical route, and that's a long drawn process. But dialing back a little bit, the use of this from a fiber setting is not just a textile or just only a construction material. At Bohico, we have made graphitic nanosheets out of this. We've tried this in electric conductors and battery technologies and electronics. There are companies in India that are actually making paper out of it, which adds enormous strategic value, taking away from the implications on kind of deforesting parts of India and the environmentalism aspect of it. If you're looking to use it as composite material or in MDF boards, there are people working towards great technologies in that. There are amazing products with the hemp seeds, whether it's targeted products to help with your nutrition, or even fun products in industries like the personal care industry, for example, the likes of Beardo, who have amazing skincare products, shampoos, etc., who we work closely with. And there are other partners and collaborators who are really coming to the fore. So I think all of it is very legal. It is basically what path that is being taken. And one thing the central as well as state governments have cleared out is their support is towards this plan. But it's important for there to be guidelines, for it to be done in the right way, to be done sensitively, so that everyone benefits in the best way possible. So I think that is just a brief summary on how the legal status is quite clear, as you correctly mentioned.
Right, right. So thank you so much, Jahan, and thank you so much, Dr. Swapnil, for your time. And I think this was a really very informative session today. And I can see the number of audience, the level of engagement, and everything is again very much like people are involved in this. From last 1 hour, they are watching us live, and I think these kind of sessions will definitely make an impact as far as creating awareness, disseminating the knowledge, and involving more and more people and making them aware. In fact, I request all of you who are watching this session right now, please do share this link, the video of the link. Do share in your network, your family, friends, seniors, juniors, colleagues, whosoever you want. Please spread this across, because I think there are so many people who are suffering. Our aim, our one of the most important aim is, there are so many people who are suffering, and if we are able to give them the healing, we are able to give them the relief in their sufferings. I think that is the primary aim of each one of us sitting here and talking about this particular plant. And rest is secondary and rest is additional, but the main aim is to help people in their sufferings, and this can be an excellent solution for them. So on that note, I would again request all of you to please support us in this way every time. And again, thanks, Dr. Swapnil. Thanks, Jahan, for your time. And we are very much thankful to Bombay Hemp Company for enabling us to do these kind of sessions. And we are looking forward to have many more sessions with you both, eminent speakers of the day today. Thank you.
Thank you so much.
Thank you, doctor. Thank you.
Thanks.